Good afternoon, everyone, and thank you for joining us. We are thrilled to bring you UC Davis's 5th Big Ideas virtual event, a series of online events we are running weekly through early June. For those of you whom I haven't yet had the chance to meet, my name is Mariel Hughes, Executive Director of Development and your contact for UC Davis. A lot has happened in Davis and Sacramento these last couple of months. I'm happy to tell you that UC Davis and our health system have been working relentlessly to combat COVID-19. Earlier this month, a COVID-19 patient was released from the medical center on his 81st birthday. He had been in the hospital for 50 days, and during that time became the first patient to connect with his family through the medical center's new virtual visit program. How great is that? You can also read the latest UC Davis expertise on the coronavirus, from clinical trials to veterinary research to societal impacts, at a new one-stop shop website, ucdavis.edu/COVID-19. And beyond COVID-19, our healthcare team continues to provide essential patient care, like cancer surgeries, organ transplants, and trauma care for the region. On campus, we've set up strict incremental steps to allow the restart of further critical research projects while maintaining adherence to public health guidance. Last week, the University of California Board of Regents met. They indicated UC campuses will be open in the fall, but the question of how much of that instruction is in person versus remote learning is still up in the air. As campus leadership continues to determine how to resume activities on campus both safely and effectively, we will keep you posted. Until then, we are glad to have this opportunity to meet with you virtually. If you have any questions during today's presentation, please type them in the Q&A box in your screen. We will also have a short poll at the end of the Q&A for you to fill out, so please take a minute to do so when it pops up. I think that's it for housekeeping. Let's get started.
Driven by curiosity, passion, and ambition. Championed by a community of supporters and the philanthropy of donors, the top minds of UC Davis have embarked on journeys of discovery, forging their own paths with transformative projects that will push boundaries, inspire change for generations, and provide solutions to the most urgent and critical problems in California and the world. Join us for an all-new virtual event and exclusive insider's view as we explore the many ways UC Davis is outgrowing the expected and how our cutting-edge ideas of today will become the impactful realities of tomorrow. Ladies and gentlemen, please welcome UC Davis Chancellor, Gary May.
I am so glad you were able to join us. I hope you and your family are happy and healthy today. While firearm violence in public places has paused due to the shelter-in-place orders across the country, we ask ourselves, what happens when large public gatherings are allowed again, this time with widespread unemployment and unrest? Violence is a major issue of our times, even as the forms may shift from high-profile mass shootings to less visible types of violence, such as domestic violence and suicide. Ending violence in our classrooms, our homes, and our communities is the mission of our big idea to launch the Center for Violence Prevention Research. You may already know that UC Davis is a national leader in violence research, but we're also turning science into action. With our proximity to California's capital, we are often called upon to inform legislators about data that is used to create public policies related to violence prevention. And our influence is also national. With input from our experts, last year, Congress voted to substantially fund gun violence research for the first time in decades. I'm excited for you to hear about how the Center for Violence Prevention Research will support progress like this and more. Thank you again for tuning in to learn more about this life-saving big idea.
Thank you, Chancellor May. Now it is my pleasure to introduce our Big Ideas champion, Dr. Garen Wintemute, a UC Davis emergency room physician and the director of the UC Firearm Violence Research Center, as well as director of the Violence Prevention Research Program. Dr. Wintemute's passion for studying violence stems from his experiences in the ER. Distraught by the number of emergency room patients needing care for bodily harm, Dr. Wintemute felt compelled to do something to prevent such violence in the first place. He has devoted his career to studying and preventing violence of all kinds, from private domestic incidents to mass shootings. As one of the world's leading experts in gun violence, Dr. Wintemute has given countless interviews in national media to emphasize the importance of this issue. In 2017, he launched the "What Can You Do to Stop Firearm Violence" pledge program for physicians across the United States. The program has garnered thousands of signatures from doctors who are actively screening their patients for gun violence risk factors and teaching safety measures. I'm looking forward to hearing the details of this exciting big idea directly from him. Dr. Wintemute will be joined by other members of his team during the Q&A session. Please help me in welcoming Dr. Garen Wintemute.
Thanks, Mariel, and hello to all of you, and thank you for coming. Many of you are here because you refuse to accept violence as part of some new American normal, and you are determined to do something about it. I'm here to tell you that you've made the right call. You know that we all face a moral imperative to prevent violence, one that's every bit as binding as the oath that clinicians like me take to treat it. Up until relatively recently, this point of view was a tough sell. The best articulation was this one, which came from David Satcher just after he took over as head of CDC. It required a paradigm shift, a fundamental rethinking of our relationship to violence for all of us as a society and for each of us as individuals. It meant understanding that violence is not someone else's problem. Whoever we are, it's our problem. And now, of course, we're all epidemiologists fighting a pandemic together. So let's consider what's happened just in the last 4 months. The pandemic and our responses to it have brought profound insecurity on many levels. This has led to a surge in firearm purchases that is greater than any we have seen before. We are already seeing increases in interpersonal violence, in intimate partner violence, and in hate crime, and for many reasons, we expect to see an increase in suicide. Our group here at the Violence Prevention Research Program has already launched a study of these trends here in California and nationwide that's going to reveal what's occurring in near to real time and hone in on causes and opportunities for prevention. We expect to have our initial results by the 4th of July. But let's step back a moment and take the longer view, which is often helpful at times of crisis. What about all those people that Dr. Satcher talked about? In the last 10 years, a great number of people, 105 per day in 2018 on average, have died from firearm violence. That's nearly twice as many as in our largest mass shooting every day, day in and day out. You see Arlington in the background. Epidemiologists emphasize the power of comparison, and I put that image there to remind me to make this comparison to you. In the United States, we have lost more civilians to firearm violence in the last 10 years than we had combat fatalities in World War II. At 2018 rates, we could fill a second Arlington to this one's current capacity just with civilians who die from gunshot wounds in just over 11 years. But what sometimes makes me a little crazy and other times makes me quite optimistic is the fact that it doesn't have to be this way. Look at that top line. In the case of motor vehicle trauma, America did something that it could be very good at and is justly proud of. We recognized the problem. We called it an epidemic, and we mobilized. We put top people on the case and said, study this, understand it, make recommendations for intervention. Congress stood waiting in the wings to put those recommendations into action. And give it a few years for that process to take place, we stopped that increase in motor vehicle trauma. And it's been pretty much downhill ever since. But with firearm violence, we've taken the opposite approach. Not once or a few times, but over and over. In Washington and across most of the 50 states, we have consciously, deliberately, repeatedly turned our backs on the problem. The effort in Congress was led by a man who described himself, these are his words, not mine, as the point man for the National Rifle Association. The result of that is that those lines have begun to cross. And we can tie this long-term trend to what's happening right now. We're all epidemiologists. Think ahead to what those lines are going to look like at the end of this year. Motor vehicle trauma is going to go down because we're driving less. And we're already seeing an increase in violence. The reversal is going to become more pronounced. The irony is that there was a federally funded research effort on firearm violence. It began nearly 35 years ago, but as I mentioned, was brought to a halt by Congress. It's as if we had decided not to do research on motor vehicle injuries. But it's different this time. And our expanding team is helping to lead a new mobilization to prevent violence with a new generation of researchers and with levels of support for change that have not been seen in 50 years. This new mobilization as well must rely on applied and policy relevant science. Here's an example, again, from firearm violence. On the left is an image that you're familiar with, even if you've never seen it. It's the one that tells of the terrible concentration of risk for firearm homicide among young African American men. But on the right is one that you're not likely to be familiar with, even if you're living it. It's the one that shows that risk for suicide is highest among white non-Hispanic men, and it goes up, not down, with age. Bear in mind that firearm suicide is 75% more common than firearm homicide. And the upshot of this is that beginning in the late 30s, more deaths from firearm violence occur among white non-Hispanic men than anyone else. Who knew that firearm violence was so much an old white guy problem? Most recently, it's been the coronavirus pandemic that has focused our attention on violence. In recent years, it's been mass shootings. Parkland, Orlando, Las Vegas. Here in California, and just in the last 2 years, Fresno, Orinda, Gilroy, Yountville, Thousand Oaks. In the next few weeks, new research is going to shine a very powerful spotlight on violence as a health problem. And people will again be asking, when will Congress act? When will somebody do something? I think that's the wrong question, as this pandemic is teaching us. The real question for everyone in the country and for each of you is, when will I do something? Will this right now be the moment when I make a commitment and dedicate my knowledge, my skills, my resources to being part of making change for the better? Let me introduce you to some people who already have. Up until a few years ago, there were 4 people in our program, 2 of them full-time. One person had a doctoral degree. Across 20 years of essentially no funding for research on firearm violence, there were perhaps a dozen people in the entire country who made a career commitment to the field. Now, there are more than that in our building. There are 11 other people with doctoral degrees, and the rest of them are real scientists. They represent epidemiology, sociology, economics, criminology, psychology and psychiatry, policy analysis, and evaluation science. They're backed by a superb team of analysts and staff, and by collaborators at Stanford, at Johns Hopkins, at Harvard, and elsewhere. They understand the personal and the professional risks that they take, and nonetheless, they have committed their careers to work in this field. More than one have told me that they're doing it for their kids. Their fresh ideas, their sophisticated training, their collaborative and interdisciplinary approach, and frankly, their sheer energy fill me with optimism. They are people who are going to change the world. There's still far too little support, particularly the long-term support that would allow me to say to them, if you come here, you'll have a job. But we're working hard to fix that, and I hope you'll help us. Now, we're broadening our efforts as we take on a new identity as the Center for Violence Prevention Research. Our work on firearm violence will continue to grow, but we understand that preventing firearm violence requires attention to violence as a whole. We are also focusing upstream on the social, the economic, the cultural determinants of violence, and downstream on the consequences of violence. Let me say a word about how we do this. We do research, much of which can be done nowhere but here in California, for the simple reason that knowledge is power. We do policy development because we are scientists who recognize that the scientist's job is not done when the science is. We do communication because how the nation talks about violence shapes how we think about it, and that determines what we do about it. And we do education and training because, believe me, this is a movement, and we are just getting started. Across all of it, we are proving what can be done. We are expanding the nation's understanding of what's possible. I hope that you'll be willing to support our effort by helping to launch and sustain these remarkable people. Without question, and for the first time, violence is seen as a problem that affects all of us. There's an increasing demand for action based on solid scientific evidence to save lives and to restore communities to health. And our continuing mission, simply put, is to make sure that as demand grows and as policymakers and the public come looking for the evidence, it's there waiting for them. I'll close with this. By supporting the Center for Violence Prevention Research, you will help make change now and make the effort to make change permanent. But in any case, I hope that you will be an advocate for the science of violence prevention and for interventions based on that science. And that last line is something that hangs on the wall in my office. You know it as well as I do. Work like this is how we fulfill our duty to the future. Thank you very much.
Thank you so much, Garen. That was great. Now I'd like to introduce some key members of the Center for Violence Prevention Research team: Nicole Kravitz-Wirtz, Rose Kagawa, and Hannah LaCure. I'll start with Nicole. Nicole Kravitz-Wirtz is an assistant professor with the Violence Prevention Research Program in the Department of Emergency Medicine. Her research focuses broadly on the social policy determinants, consequences, and prevention of violence and related health outcomes over the life course and across generations, with a particular emphasis on inequalities by race, ethnicity, and the residential environment. Nicole, please tell us more about your work.
Thanks, Mariel. And hi, everyone. Thanks again for being here today. I'm actually a sociologist by training with an emphasis on the social and policy determinants and consequences of population health and health inequity, which means essentially that I'm interested in the impacts of upstream macrostructural forces, specifically the impacts of things like income inequality, racism, and residential segregation on violence, particularly community violence, and related health and social outcomes that disproportionately impact communities of color over the life course and across generations, as well as interventions to change the community conditions tied to those inequities. My research since coming to UC Davis falls within two broad buckets. I'll mention both really briefly today. The first focuses on addressing fundamental questions and gathering basic data critical for addressing the public health problem of firearm violence. Questions like how many Californians own guns, why do they own them, and how do they store them? Data like this hasn't been collected in California since the 1970s. That is, until 2018, when we developed a statewide population representative survey to do just that. Now, the California Safety and Wellbeing Survey, or what we call CSAWS for short, is an ongoing statewide data collection effort administered at regular intervals with questions tailored to pressing public health and policy issues of our time, meaning that our next survey wave to be in the field within the next month or so will focus on the intersections of firearm violence and the coronavirus pandemic. Now, my second line of research focuses on the long reach of community violence. Community violence is intentional, interpersonal violence that occurs in public places and disproportionately impacts communities experiencing social and economic inequities, including concentrated poverty and segregation. Here I focus on policies and interventions to disrupt what is too often a cycle of violence, wherein violent injury is a significant risk factor for future violence involvement and re-injury. In fact, past evidence suggests that in some communities highly impacted by violence, rates of re-injury after discharge from the hospital are as high as 62%. Part of my research now involves working with and evaluating the UC Davis Med Center's violence intervention program called Wraparound, which extends care for violently injured young people 13 to 26 years of age beyond the hospital setting to address risk and protective factors for and root causes of violence through relationship-based mentoring and individualized case management for up to 1 year after hospital discharge for a violent injury. Related to this work, I also have several current grants and grants in the works that will study the prevalence and consequences of and the modifiable points of intervention across the social ecology to address not only direct, but also indirect exposure to community violence, that is seeing or hearing gunshots or living in violent environments across the life course. But I know I'm out of time, so I'll be happy to answer additional questions about this later as well. Thank you.
Great, thanks so much, Nicole. Rose Kagawa is an assistant professor in the Department of Emergency Medicine. She conducts research on violence prevention and firearm policy and has particular interest in understanding how social and environmental contexts influence violence perpetration and victimization through the life course. Rose, what are your current projects?
Hi, thanks so much for having me. It's so nice to have even just a hint of normalcy and connection in these strange times. So I have two main areas of research that I'll cover briefly and two ongoing projects that represent each well. So one body of research seeks to identify the specific ways that firearm policies can be improved to increase their effectiveness in preventing firearm violence. This work has centered on background checks and related policies. Background checks are the backbone to our country's firearm policy. Any limits to firearm purchasing, whether these are age restrictions, mental health concerns, or indications of dangerousness, are operationalized through background checks. But over the past few years, our work has identified critical limitations to our country's background check system, and we're now working to identify best practices in the design and implementation of these policies with the end goal of reducing firearm harm. My second body of work widens the lens to focus on structural causes of violence, wide-sweeping social, environmental, and economic factors that lead to violence. And importantly, I want to understand how we can change these things realistically and meaningfully to reduce violence in a massive way. To take one example, 1 in 4 homes in Detroit are vacant, 1 in 16 in Cleveland. Research demonstrates that vacancy is associated with crime, including gun violence, and both cities have firearm violence rates that far exceed the national average. Both cities are also home to expansive demolition programs, which have removed vacant and decaying buildings from the landscape by the tens of thousands. And so we're currently testing for effects of demolition on fatal and non-fatal shootings in these two cities. And this is more relevant than ever. The destabilizing effects of COVID-19 are already being felt, and disproportionately so across the country, exacerbating pre-existing inequalities. The direct effects on health are coupled with income loss for individuals and businesses due to shelter-in-place orders that will likely have long-term effects on neighborhood vitality, health, and safety. It's critically important for us to understand how to stabilize hard-hit neighborhoods as we likely enter another recession.
Great. Thanks so much, Rose. Next, we have Hannah LeCure, who is also an assistant professor in the Department of Emergency Medicine. She specializes in criminal justice policy and the economics of crime, and her research includes work on substance use and drug policy, gun violence prevention, and machine learning methods to improve and evaluate decision-making in the criminal justice system. Hannah, please give us an overview of your areas of study.
Great, thanks so much, Mariel. So one of my primary areas of interest is in applying modern computational and statistical techniques to understand crime and violence and improve related law and policy. So for example, a project that I'm currently leading with members in our group involves using machine learning predictive models to analyze more than 5 million handgun purchasing transaction records in California to identify important risk factors for violence, suicide, homicide, and mass shooting. We're using algorithms to detect unique patterns of purchase that may be suggestive of subsequent violence, and developing risk prediction models to identify high-risk individuals, with the idea that such models could potentially aid law enforcement efforts, hospital efforts, to intervene and prevent future gun violence. Some other topics that I've recently worked on include a study looking at the association between mass shooting related spikes in handgun purchasing and subsequent firearm injury, a project using computer text processing to analyze thousands of California parole hearing transcripts to better understand parole board decisions, and a new project that will look at police decision-making and racial bias. It involves experimental simulations, surveys, and machine learning analyses of police field data. I have work under development focused on illicit gun markets, networks and risk indicators for trafficking, and market responsiveness to law and policy interventions. And I'm also taking part in our group's new efforts to look at the impact of COVID-19 on firearm violence, the consequence of the surge in gun purchasing across the nation that we saw at the outset of the pandemic, and the impact of stay-at-home orders on violence both outside as well as inside the home.
Great, thanks so much, Hannah. So we've actually gotten some great questions from the audience. So I'm gonna now turn it over to the four of you to answer these questions. So I think this first question is probably for Hannah. So if you would mind just kind of staying on the screen. What is your advice for safety for non-gun owners in rural areas where gun ownership is especially high, particularly as this pandemic progresses and people become more stressed and perhaps bold in their actions?
So I think that my advice for safety is probably no different than the sort of advice for safety in the pre-COVID era. You know, things, I mean, in some sense, it depends on safety in what regard. Stay-at-home orders are obviously keeping people in their homes more. So sort of violence outside the home is probably at lower risk, but there is increased risk inside the home. And, you know, that's something that we're sort of very mindful of. But I turn it to others too who may have more concrete advice. Garen, for example.
As soon as I can find the unmute button. Hannah's work has shown that spikes in gun purchasing, and we are in the middle of one right now, are followed by increases in firearm violence and death. And complementary to that, we did a study 20 years ago, and there's another one that I'm involved in that's coming out, I think, next month, that show that bringing a firearm into the home drastically increases by a factor of more than 50 in some cases, one's risk of suffering a firearm related death. So for me, not just as a public health person, but as a clinician, my advice is if you're contemplating bringing a gun into the home, think long and hard because the risk numbers are not on your side.
Thanks for that comprehensive answer. Garen, this next question is for you. Is your team doing research on the correlation of gun violence to antipsychotic medications?
We are not doing specifically, and others chime in if you're aware of a project that I'm not. We are not specifically doing work on the relationship between taking psychiatric meds and either reductions in violence through the improvement of mental illness or increases in violence through occasional adverse effects. Others at the university are doing that kind of work. More generally, I will say this. There's a huge body of work that shows that effective treatment of mental illness is associated with a drastic reduction in risk of violence among people who receive that treatment.
Mm-hmm. Thanks so much, Garen. Nicole, the next question I'm going to direct to you because this is really more about California. It seems like California safety, well-being. Can you talk about how you respond to people who claim your research is aimed at removing guns from law-abiding citizens?
Sure. I'll start, and then I'm sure others on the panel will chime in as well. So I think all of our research is based in an interest in scientific inquiry. So we want to know what works to prevent gun violence. We have none of our projects are centered around removing firearms from law-abiding citizens. So we're interested in developing policies and programs that are driven by the data and the science, period.
Great. That's good to hear. Thank you. Garen, I think this question is probably for you. What is the relationship between the center and policymakers such that you can reach policymakers with your research and get them to use it to create gun safety laws and regulations? So kind of the flip side of the earlier question.
Yep. First, just to piggyback on what Nicole said, more than once, findings from our research have caused great consternation to the, if I may, gun control crowd. We are driven by the evidence and not by a policy agenda. Having said that, the policymakers, for my money, the smartest, most evidence-driven state government on the planet are 10 minutes from where I'm sitting at this moment. And it is part of what makes us effective that we can take solid science downtown to people who want to know what lessons it has for them. We work on a regular basis with policymakers, from crafting ideas to drafting specific pieces of legislation on occasion. We are now also, the crew you see in front of you and many others, are the core of the University of California Firearm Violence Research Center, which Mariel, you mentioned right at the beginning, which is a state-funded effort to produce that sort of evidence that lies right alongside the Center for Violence Prevention Research that we're talking about today.
Excellent. Thank you for pointing that out, Garen. I'm going to direct this next question to Rose. And if it's not Rose, please feel free to pass it along to someone else. One of our viewers is reading more about the increase in ghost guns in our communities, and if you're able to determine their impact on domestic violence, or if it's too early to determine.
I am going to pass this one on. Okay.
To Garen. Okay.
Yep.
Great.
Unless, nod folks, does somebody else want to pick that one up? Because I'm talking a lot. So ghost guns are guns that are made without serial numbers. They can be made at home. One can buy a kit and make a gun without a serial number. That's actually not illegal to do as long as one keeps the gun as one's own personal property. But what we're all concerned about is the manufacture of these guns at scale for criminal purposes. They are a bigger part of the problem than is being talked about, to be quite honest. The kit manufacturer doesn't take a lot of money to put into place, and probably a few years down the road is 3D printing. There are 3D printed guns available now. The materials aren't durable, but it's probably a matter of time. I will say this. Over the entire history of this country, efforts to prevent firearm violence have come up against new developments in firearm technology. This is not something fundamentally new. It's just the newest iteration of how answering the question, how do we prevent violence as the guns get more capable of destruction?
Yeah, thank you, Garen. The next question is around artificial intelligence. So I'm going to direct that one to Hannah. Hannah, how do you envision the machine learning program will look in 5 years?
The machine learning program that we're undertaking?
Correct.
Yeah, great. So we're right now analyzing handgun transaction records. And last year, California actually passed a law that now we have records of ammunition purchases. And so actually our hope is to set this up and build predictive models, but to develop those further with these ammunition purchases, which I think in many ways may provide more signal than the handgun transaction records themselves, because you only need one gun to commit a bunch of firearm violence, and often with mass shootings in particular, large purchases of ammunition sort of provides even more signal. So our hope is to continue the work that we're already doing and expand with new data that we'll be getting in California. In principle, the sort of work we're doing, which is California focused, could be expanded to other states. Insofar as there are other states, and there are a number that also have records of firearm purchase. So I think, at least with regard to looking at these sorts of transactions and seeing, I saw someone else asked a similar question about sort of parallels to banks and credit card companies. And there are, I think, where, banks and credit cards have systems in place where they flag unique transactions. And we anecdotally have a number of stories of mass shooters that have sort of very suspicious purchasing behavior right before an event. And so I think, our hope would be to sort of continue this work, expand with all sorts of records that we can look at and sort of try and integrate to get a better picture of risk factors and better picture of sort of red flags.
Mm-hmm. And it sounds like this data already exists, and so you're just trying to find interesting ways to look at it and to kind of look at it predictively.
Yes, exactly.
Great. So this next question I'm going to direct to Rose because it's around property. So as property inequalities for non-white populations are being lessened, there is more community violence against non-white individuals who live in suburban communities. Is there any research being done on this new type of community violence most recently in the news?
I'm not sure how to answer this one, and Nicole, I don't know if you have any thoughts on it either.
I mean, we should tag team this, Rose, because I think some of the work that you're doing in Detroit and Cleveland still applies. But I think more broadly, what we're seeing and what we see from the research on violence in sort of the public places of communities is sort of not necessarily, or the factors that are associated with violence in communities are similar, whether they're taking place sort of heavily concentrated in sort of urban city locations and sort of more broadly in suburbia. And I think what we see there is that reducing things like segregation, especially racial residential segregation and concentrated poverty, improving people's living conditions, their meeting their basic needs, are all associated with less violence. And so as we continue to sort of address those upstream risk and protective factors, I think that sort of applies across the board. But I think, Rose, your work, like I said, in Detroit and Cleveland that you're doing applies across the board as well.
And I think maybe, Rose, if I could direct it, oh, sorry, go ahead. I was going to say, maybe it's as more buildings are being demolished and that has an impact on crime, like where does the crime end up happening?
Yeah, that is an active question. So one, we're looking at whether crime in the immediate area surrounding a demolished former building decreases, with the idea being that now you have, rather than a hidden place where crime could occur, given the opportunity, you have an open space, and these spaces are maintained so that they remain open. But then the question is, does the occurrence of crime move to another place, to the neighborhood next door, or does it disappear entirely? Or are we actually, by demolishing and changing the physical structures in these cities, are we actually changing not just the crime and the interactions that happen every day around those places, but the populations that live there and the economies and the businesses, such that if there's some change in crime, it's the result of a broader change in who lives there and whether or not that's a fair approach to crime reduction.
Great, thanks so much, Rose. So I'm going to direct this next question to Garen. Garen, what recommendations are currently on the table relative to specific actions for reducing gun violence? I.e., what have you achieved so far?
In 30 seconds or less. I'll speak as a clinician first. We are very much engaged in an effort to get health professionals in California and secondarily around the country knowledgeable about firearm violence so that they can incorporate prevention into the practice of medicine. In some cases, routinely, pediatricians need to know if their patients have access to firearms. But also, regardless of specialty, and particularly for emergency physicians like me, at times of crisis. So if I see somebody who's suicidal, I need to know if there's a gun in the home and what access they have to it. And I need to know what to do, and not making this up. If the story is, yeah, well, I'm here, the ambulance brought me in, I'm suicidal, the gun's still sitting on the nightstand. I need to know what to do about that. And we've worked with policymakers on that. At the strictly policy level, I'm going to tie together some threads here. A lot of our work has focused on what people are at greatly increased risk for committing firearm violence. Can we be really smart about policy and envision ways of preventing the problem that are very narrowly focused on the people who are disproportionately responsible for it, whether we're talking about interpersonal violence or suicide. In other cases, we look at, and background checks are an example, we look at interventions that are applied right across the population to help prevent violence. And then again, I'm tying threads together. We've come to understand that there are limits to what you can do in preventing firearm violence if all you do is focus on guns. That we need to focus on risk factors for firearm violence that are risk factors for violence generally. So we do a lot of work on alcohol at the moment and have worked with the legislature on legislation related to alcohol and firearms. And I'm painting this broad picture quite intentionally to be able to make this point. We get asked all the time, what's the one thing we should do? Should we ban assault weapons or whatever? And the answer is, there is no one thing. That's the answer. The way to prevent violence, whether it involves firearms or not, is to do a lot of things at the same time. So that, as Rose was talking about, if you intervene in an area, do you displace crime to another area? Do you conversely have what's called diffusion of benefit and other places get better that didn't receive the intervention? We're exploring all of that simultaneously.
Mm-hmm. Yeah, I know you guys have a lot of projects going on, and it seems like you're doing many different really interesting studies. Question about, it's actually kind of a question for you, Dr. Wintemute, a follow-up to your presentation. You had a data point that gun violence went down significantly around 1993 and again in 2000. Was it because of a ban on assault weapons or other gun control legislation?
I'm sorry for all the reaction. No, unfortunately, it wasn't a ban. The ban on assault weapons did not make the difference. At the time that ban went into effect, relatively few crimes were being committed with assault weapons. So from a policymaker's point of view, one could frame that ban as really smart. We didn't let the problem get big before we did something about it. From an evaluation perspective, it's difficult because if the problem wasn't big to start with, it's hard to show that it got smaller. But the reason for the laughter is that happened right at the time that the research effort, the federally funded research effort, got shut down largely. So people weren't on the job to study that as it happened, to be able to distill the lessons that I really wish we had. Because if we knew what had happened between 1993 and about 2000, we could do a much better job of preventing violence today. We have some theories, and some of those theories are more than that. They're backed by evidence. But there's no substitute for having people there at the time to study the trend as it's occurring, and that didn't happen. We're still dealing with the effects of that.
Mm-hmm. So my next, it's actually it's a series of questions around background checks. So I'm either going to direct these to Rose or Nicole, so either of you can jump in and answer. Do federal background checks work is the first question. And the second question, there are some issues with the current background check law as far as time deadlines, quality of records, biometric identification. How are those being factored into your research?
I'll start. So do federal background checks work? There's a fair amount of research that shows that on an individual level, somebody with a prohibiting background, like a felony record, goes to purchase a firearm and is denied, that they go on to commit less violence than they otherwise would have. And in that sense, it seems like in a controlled, distilled setting, background checks do work. What our recent evidence has shown is that when we're looking at the state level, the implementation of these policies, we're actually not seeing changes in firearm suicide rates or firearm homicide rates following the implementation or repeal of comprehensive background check policies. And so there's a lot that goes on between like the actual denial in a case where by law it should happen, and the prevention of population level harm. And so what we're working on now, which to your second point about record quality and biometric identification, is what's happening between, a concept that works in controlled settings and the implementation of this policy, so that we can understand what's the best way to design these, where are things kind of falling through the cracks. Is it that people aren't actually getting background checks when they do gun transfers? Is it that records are missing from the databases, which they are? Or is it that identities aren't checked very thoroughly when people go to purchase firearms? And actually all of these things are true. And so it's a matter of identifying how to sort of fill in these holes and improve the broader system.
Mm-hmm. Great,
thank you. I'm going to piggyback very briefly, agreeing with everything that Rose said. A lot of the research that she's referring to was done looking at background check policies at a time when the checks were probably less effective than they are now. The data, the checks are only as good as the data they're run on, and the data used to be really awful, and they've gotten better, but they're nowhere near where they need to be. There's lots of room for improvement. The other thing is, I think we should differentiate between a comprehensive background check policy, which requires that a background check be done all the time, and something that is called a permit to purchase policy, or is more recently called licensing, where in addition to having the check done, you actually have to get a permit, which often involves a visit to a law enforcement agency in order to proceed with the transaction. And for those permit to purchase policies, the evidence of effectiveness is much stronger than it is for background check policies more broadly. And I'm really glad that Rose is nodding, because Rose is the expert here. Rose, if I got that wrong, just correct it. Okay.
Great, thanks all of you. Garen, I'm gonna direct this next question to you. It's around red flag gun policies. Can you talk about the effectiveness and issues with red flag policies, and does your research support these? Have you been effective in getting more states to adopt them?
So I'll be brief on this one. The so-called red flag law, it's a term we don't use. I'm going to switch terms on you and talk about extreme risk protection orders. The idea is this. A person is in crisis and is making a credible threat to harm themselves or others. Firearms are part of what makes that situation a crisis, and no alternative action is available. Under those circumstances, in California and nearly 20 other states, it's 17 or 18 now, someone can go to a judge, sort of the way we do for domestic violence, and say, Your Honor, we have a problem. And Her Honor can follow some specified rules of evidence and make a determination that, yes, there is a crisis And following due process of law, we're going to have those firearms removed from the situation until we can sort this out and get the risk reduced. This is a policy, something like this policy was in effect in a couple of states, Connecticut and Indiana. The evidence of effectiveness there was actually fairly strong. A death prevented for every 10 to 20 times the policy was used. And I'll tell you as a clinician, a number needed to treat, as we call it, of 10 to 20 for saving a life, that's a good treatment. California had the first extreme risk protection order policy. We enacted it following the mass shooting and stabbing in Santa Barbara, the anniversary of which was just a few days ago, actually. We and others are evaluating those policies. I will say this, we've published data on a series of more than 20 cases here in California where the crisis was a threatened mass shooting. And in those 21 cases, extreme risk protection orders were sought and obtained, firearms were recovered, and none of those mass shootings occurred. I cannot say that the orders and the recoveries were what produced the non-events that followed, but it's a hopeful result that we're taking a further look at now.
And then can you speak to the adoption by other states for these types of laws?
Yes. As I said, 2 states, Connecticut and Indiana, had something similar. We pioneered, actually people on the call right now were involved in drafting the legislation. We pioneered the extreme risk protection order. I think we are up to 17 states now that have extreme risk protection orders. Many of them adopted following mass shootings. We developed the pattern, but the action that really led to the current very rapid adoption was the mass shooting in Parkland, Florida, after which Florida adopted an extreme risk protection order policy modeled on California's.
Yeah, and that's got to be a big surprise.
We've had a great deal of impact.
Yeah, that's amazing. So the next question, I'm not sure who to direct this to, so just jump in. Question about what advice do you have for parents of young children who are just entering the school system as far as school safety and violence?
Rose, would you be interested in taking that question as a mom with kids who will be entering school? I mean, I can talk about the data, but I don't know that that's the best way to answer the question.
So you should couple this with data. But my sense is, so the risk of school shootings is actually quite low. And if that's the concern that the questioner is getting at, what concerns me more in some ways is the drills to prepare for an active shooter event and the emotional consequences of engaging in that and living through it, even if it's not real in that moment. And that's, and now Garen, I'll throw it to you for some data.
So I'll just point out that you led with data. So yes, school shootings are really rare. Kids are much more at risk of violence on the way to school, or sadly, in many cases, at home, than they are at school. Mass shootings at school are very uncommon. Shootings at school are very uncommon. I'll just connect the dots a different way. Those guns that kids bring to school and shoot other kids with, they come from those kids' homes. Mm-hmm. So parents who are concerned about school shootings, first thing they need to do is make sure that their guns in their own homes are secured. I mentioned in the pre-recorded little presentation that I made that several people in our group have told me at one time or another that they're in this game because of their kids. And so I want to make that broader point. I think one of the things that drives us, and I suspect one of the things that has brought more than 200 people to this call, is we all recognize that we're not living in the society that we want to live in, and that we are all individually part of and responsible for making that society that is more the one that we would like. We're doing it for ourselves, but we're also doing it for our kids and our grandkids.
Mm-hmm. Thanks, Garen. So I don't think we really have time for any more questions. We're at 12:58, but I know we did have many great questions from the audience that we will we'll get back to you individually or as a group. We'll make sure that you get these questions answered, because I know that you know, if you took the time to write it, you do want to find out what we think. So I will end the formal part of the presentation. Really thank you for being with us. Thanks to Garen, Nicole, Rose, and Hannah. And thank you to our audience for all the questions. If you were interested in learning more about the Center for Violence Prevention Research, please contact Brenda Betts, whose information will be on the screen. We could not do all the work we've spoken of today or do it so well without private philanthropic support. With your partnership, UC Davis can have a positive impact on the student experience, on the interdisciplinary fields we touch, on society, and on the planet. Although we couldn't gather together in person, I want to express our gratitude to each of you for taking the time to connect with UC Davis. We have just one more event in our Big Ideas webinar series, and I hope you'll join us. Our next event on Smart Farm will be next Wednesday, June 3rd, from noon to 1 p.m. Pacific. The webinar will focus on leading a new era of agriculture and showcasing modern farming. Please make sure to register if you are interested. On behalf of the university, we hope you are staying healthy and safe, and I look forward to connecting with you again. Thank you again, and take care.